So the Better Breathers Club of BC is put together by the BC Lung Foundation and hosted by Poplar Pulmonary Wellness. Oopsies, that's not what I wanted there. Let's do that. Can you see that all okay?
Looks good.
All right. We are talking today about how anxiety affects your breathing, and we have our guest speaker, Dr. Sarah Bellefontaine, who's a clinical psychologist from Ontario, actually. And Dr. Sarah is a clinical health and counseling psychologist from Ontario. She provides evidence-based therapy for adults dealing with anxiety, depression, PTSD, interpersonal issues, grief, and life transition. She has a special interest in supporting individuals with chronic health conditions and those navigating pregnancy and postpartum challenges. She has experience across various clinical and hospital settings, including private practices, family health teams, and major hospitals. And she currently works at her own practice for Wings Psychology. So thank you so much for being with us today, Sarah.
Thank you.
We would like to acknowledge the land on which we work, live, and play as the unceded traditional ancestral territories of the Coast Salish peoples. And for Tina and I, who are in Vancouver, that's the Squamish, Tsleil-Waututh, and Musqueam nations. Feel free to post in the chat if you'd like to share with us the lands on which you're on this afternoon or this evening, depending on where you're joining in from. This space that we're creating here for our Better Breathers Club of BC, we want to make this a safe space. So you are welcome to share your thoughts, values, opinions. Please ask your questions without fear of judgment. And we thank you so much for creating this safe place for everyone to share and be.
There you go.
I had a little icebreaker, and I'll share it just as I stop the screen share here. So there were two muffins in an oven, and one muffin said to the other, "Oh, it's really hot in here." And the second muffin said, "A muffin."
You cut out. I missed the punchline.
Oh, no. So repeat it.
What's this part?
Okay,
Say it again.
there were two muffins in an oven. And one muffin said to the other, "Oh man, it's really hot in here." And the other muffin said, "A muffin that talks."
I can't. You cut out again on me.
You know what? You're activating your headphones, I think.
Yeah.
Oh, I see.
She said, "Oh no, a muffin that talks."
All right. So without further ado, I will hand off to Sarah.
Wonderful. So I'm going to share my screen. Hello to everybody. It's so lovely to meet you all, and just to hear a little bit of, kind of some of you shared a little bit about what's been going on. So that was really nice for me to hear and just get a feel for the group too. So I'm just going to share my screen over here. And then I'll go into the full mode. Okay, can everybody see that?
Yeah.
Perfect. Okay, so we're going to be talking about, how to manage anxiety with a chronic lung condition, and that can be a little bit tricky. So let me there we go. That's how we change things. So I thought I'd talk a little bit about who I am, then talk about what the impact of chronic lung conditions are in a very, very overview kind of way, one slide. And then get right into anxiety, how that plays with our lungs and, any lung conditions that we might have, and then get right into some helpful strategies. We'll have a Q&A at the end, but feel free to jump in with any questions along the way. I'm always happy to have people jump right on in with some questions they might have that are burning. So I started with a quote that stood out to me. Sometimes the most important thing in a whole day is the rest taken between two deep breaths. And the reason that I added it here, is because I think it really highlights just how much people take for granted our ability to breathe and breathe easily. And so it makes it seem so trite and so easy. And it got me thinking about what happens if that's not the case. If it is a little more challenging to be able to take 2 deep breaths, for example, and what can we do to support, and manage some of the anxiety that comes up if that's not always possible? How can we kind of get things back on track? So in terms of who I am, as Jenna mentioned, I'm a clinical health and counseling psychologist. A health psychologist is just a fancy way of saying that I work with the intersection between physical health and obviously our mental health. So I work with a lot of people with a bunch of different chronic health conditions. I've worked with people with cancer, with heart disease, certainly chronic lung conditions. I have a private practice in Ottawa that I'm currently running. I also have experience with lung conditions. So just to share a little bit, I have one of my kids that does have she does have anxiety too, but she has asthma, and certainly that's taken us to the ER just a few times. So in terms of the impact of chronic lung conditions, it has a huge impact on our quality of life. So it's something that impacts pretty much every aspect of your life, from what you choose to do to how long you can do things for. And I heard a little bit of talking about this at the beginning, which, really, kind of resonated with me. And, even what activities you can choose to do, and even for how long you can do them. The other thing that really stood out was just the impact of, having to potentially carry around equipment, specialized equipment, in order to make things a little bit easier to breathe. So all of those things have a huge impact on our quality of life. And when that takes a bit of a toll, that can lead us to feeling some anxiety and some depression. So we're going to really focus a bit more on anxiety, but I'm always happy to talk about depression as well. Because both of those things kind of go hand in hand together often. And then with anxiety and depression, that obviously has an impact on how we feel about ourselves, and it impacts, how we breathe. So what is anxiety? It's really our body's reaction to a perceived danger that it really wants us to pay attention to. So it's that fight or flight response that we feel when something's coming on. The difference between anxiety and stress is that stress is something that we're feeling in that particular moment. So for example, if I, like Bobby was sharing earlier, if I drop a cup of coffee on me, then certainly that's something, that's more of a stress in that moment, versus something that's more future focused. So the reason that that anxiety developed is really to help us and to protect us, but it sometimes really just goes a little bit overboard and reacts a little bit more strongly than we would like it to. So that leads us to talking a little bit about this anxiety breathlessness cycle that some of you may be familiar with and maybe not. What happens with that is that our anxiety is either triggered by breathlessness itself, by feeling breathless, or having some sort of worried thought. That leads us to then feel that breathlessness a bit more in our bodies, and then we start to worry. Oh, I'm going to die. I don't want people to see me like this. I need to get out of here. I start to get panicky and overwhelmed. And when those kinds of feelings come on, my body starts to react. And so then I start to feel some physical changes. My chest might start tightening. I might start breathing a bit faster. And of course, that's going to lead me to feel even more breathless. And then I'm going to worry even more. Oh dear, is this ever going to stop? Last time I felt like this, and so it's going to keep going in that cycle until something shifts, the cycle in that moment. So when we have both a chronic lung condition and anxiety, we have a few different things that can happen. One is that can take a toll on how we feel about ourselves. It's really, not great, having to, kind of contend with your own health. It's something that a lot of people take for granted, and it really kind of takes a toll on how we feel about ourselves. It also can lead us to feel, a bit uninterested in things, a bit apathetic, just not feeling great about doing things, and maybe even a bit disinterested in things. And that, those two things, as well as other things, can lead us to feel, to not pay attention or, do the things that would normally, kind of help us in terms of our physical health. So not maybe adhering to our treatment recommendations, maybe not using medication or oxygen or even inhalers, as much as we should or when we should. And in turn, that has even more of a consequence on our physical health in terms of, maybe having to go to the hospital, or, even just increased medical appointments in general. So what can we do to help? Because that's kind of the main event here. If there is anxiety, and for a lot of people there is, with a lot of chronic conditions there are, but certainly, definitely with, with chronic lung conditions. So the first one I want to talk about is mindfulness. And that one's a bit of a buzzword these days. It's something that a lot of people are kind of throwing around. When I'm talking about mindfulness, what I'm referring to is really just the ability to be in the present moment in a kind of different way. So paying attention to either what's externally going on around you or what's, actually internally going on around you. And there's a few different ways that we can do that. So I threw up a few different ways, and I thought I'd take you through them. So the first one is what we call 5 senses. And really that's just checking in with each of your 5 senses on the go. So what do I see? What do I smell? What do I taste? What do I hear? What do I feel? And just kind of cycling through those. What that does is it connects us really to that present moment in a way that we might not otherwise be. And it takes the focus off of our breathing, off of, the stress of that and, the anxiety of that, and brings it to other things. So you can do that as many times as you want. And because there's no rules when it comes to these kinds of things, you can do it as many times as you want, and you can have things on hand to help you. So for example, in my office, just behind me, I have a couple bottles of little essential oils. And when I need to do 5 senses, I will sometimes just take a little bit of a sniff of, some of the lavender or, whatever scent is something that, kind of connects for you. As well as having something on hand to, taste, for example. So, maybe that's a nice cup of tea. Maybe it's, if you're like me, a little bar of chocolate, so something that that kind of brings some joy so that you can kind of capitalize on that in a few different ways. The second one is kind of a unique one. I call it the National Geographic approach. I don't know that anybody else does, but I don't know if anybody's seen one of those shows where, David Attenborough narrates and he talks about the cat going across the savannah, and he does it in a very lovingly monotone way, where you almost feel relaxed, even though this is like the most high stakes scenario on the planet. And so what I have people do is take that approach and apply it to what they're feeling in their bodies. So really kind of narrating for yourself what's going on inside. So I'm noticing that, my breath is a little bit, it's harder to catch my breath right now. I'm starting to tense up a little bit. I'm noticing I'm having some thoughts about, what people are thinking around me, for example. And what that does is it distances us from what we're going through in our bodies, first of all, which is always helpful. It also, and I just lost my train of thought, but it hello, it's 5 o'clock. It distances us from where, what we're feeling in our bodies. And, it allows us to not react emotionally to what we're feeling. So the key ingredient with anxiety is that feeling that we get when it starts to come on, or when we notice some of the symptoms in our body. And if we can keep that from happening, or, reduce the amount, because we're not perfect, then, we can have less of a reaction. Then our body realizes that this isn't, as dangerous as it's feeling to us in that moment. Okay. The third one is just a walking meditation. And so really just, walking, either it can be around your room, it can be, up and down, the street, whatever, feels comfortable in that moment on that day. And just noticing what the steps feel like, maybe what the air feels like, what you hear around you, kind of integrating some of that mindfulness into a bit of a walk. So the next thing that I thought we'd look at is some breathing exercises, okay? And, certainly when we're talking about chronic lung conditions, we want to, make sure that we're doing things that are going to be helpful to our breathing and not unhelpful to our breathing. So I have a few little breathing exercises that can be helpful. The first one is diaphragmatic breathing, or what we call belly breathing. What it involves is really just putting your hands on your belly, taking a deep breath in. The ideal thing is, that you want your belly to push your hands up a bit, and then breathe out and have your hands collapse with your belly. Okay. And even 5, breaths like that can be helpful in terms of, just bringing down that level of activation. So what we're doing with these breathing exercises is we're using the same pathways that give us that fight or flight response, that kind of anxiety response, and we're using them to relax. So it's the same highway that gets used for relaxing in our body and for going down that fight or flight anxiety place. So if we're using it for relaxation, then our brain's going to get the signal that this isn't something that's dangerous, and it's going to stop sending out the alarm bells that it's sending us. So the next technique is box breathing. The animation for this is probably a little quicker than you would want to do in real life. But what you'd want to do is inhale, hold the breath, exhale, and then hold the breath, and hold the lack of breath. And then continue that again for, 5 to 10 breaths, just to, again, give your body that signal that, we're not in any imminent danger. There's no saber-toothed tiger that's chasing me right now. And then be able to connect in a different way to our body. And then there's pursed lip breathing, so taking a breath in with your through your nose, and then just out through pursed lips. Again, 5 or 10 breaths, whatever you can manage. If it's only 2, that's fine too. You're just doing your best, just working towards, making little tiny improvements for yourself and feeling a little bit better along the way. Sleep is something that I talk so much about with everybody. So that one's more of, obviously not something you're going to do in the moment when you're feeling anxious, but it, certainly can help with not getting to the point where anxiety is taking over. And not sleeping absolutely makes anxiety way worse than otherwise. So there's a few different components to that. So the first is what we call sleep hygiene. And that's, again, just a fancy way of saying, making sure that the environment that you're sleeping in supports you sleeping. So the dark room, the right temperature, a good sleep position, not really having too much caffeine before bed, all of that. Moving on to the next one, what we call stimulus control, or really just associating bed with sleep, with your, having your body associate bed with sleep. So anybody who has or has had kids knows that the way that you get them to sleep is to have some sort of process by which their body starts to learn, so maybe it's bath and bedtime, and, then we do some sort of book, and then we hopefully, get them to sleep. It's the same for our bodies. So we want that association between, me going to bed and this being a place where I sleep and not where I'm awake. So spending extra time awake in bed can sometimes get in the way of sleep. Obviously, if you're not having sleep problems, then, have at it. And I would be lying if I said I don't sometimes just lounge in bed too. But, if that's something that is, getting in the way and is, maybe contributing, if sleep is really might be contributing, then that's something to look into. And then following treatment recommendations. So, do I need oxygen for bed? Do I need to be taking some inhalers before I go to sleep? Making sure that you're following up with those recommendations. Eating well, I'm going to skip that one just because that's not my area of specialty. There are plenty of people who can give you way more information on diet and, how that can be helpful. I'm going to jump into one of my favorite things to do, which is progressive muscle relaxation. And the best thing about it is that you can do it in bed, you can do it on the couch, it doesn't matter. So with progressive muscle relaxation, what we're doing is we're going body part by body part, all the way down our body, one part at a time, and tensing that body part for about 10 to 15 seconds, and then relaxing it. And then going to the next part, so maybe our arms next, holding that, and then relaxing that. And we go all the way down to our feet. So that, what it does is it really just tires out each muscle group along the way and makes it so your body has no choice really but to feel relaxed in terms of the physical sensations that it's feeling. And then our minds kind of follow suit with that. And then last is exercise. I know my friends at Poplar do a whole lot of work on exercise, which is awesome. With exercise, obviously setting realistic goals that are going to be helpful, that are, not going to be, if you're not running 5Ks, I'm definitely not, then maybe not starting there, and, starting very slowly and just increasing gradually, so maybe, it's just walking around the room I'm in. Maybe it's walking from, the table to the couch. Anything's okay, and I'm measuring against my own yardstick and not everybody else around me, because that's not fair. And then if you can, adding in some of that mindfulness that we talked about earlier. So that can just, give you a little bit more bang for your buck. So if I'm throwing in, for example, integrating some of the 5 senses while I'm, walking around, then I kind of get a bit of a double hit. I get the benefits of the exercise along with some of that mindfulness that then starts to relax my body as well. And that's all I had. So we'll open up the floor to any questions that anybody might have. I'll stop sharing for now. Jump right on back in.
Amazing. I love that. You could almost teach our pulmonary rehab program. That was fabulous. What are people's thoughts after hearing all that amazing information?
When you were talking about sleep, you referred to a good sleep position. What's a good sleep position? Because you go to bed and you have your favorite position, but then during the night, that's not how you stay all night. You end up switching to another position. So what is a good position to get a restful sleep?
That is an excellent question. And I think, it's such a personal question. So when I'm thinking of a good sleep position, I'm thinking of something that, a position that's going to help me fall asleep, knowing that, when I'm asleep during the night, I probably will wake up, several times. That's just kind of how our bodies operate and how they're set up, unfortunately. There's some stuff I came across that talked about different, positions that work better with chronic lung conditions. I don't know what the evidence is. I haven't examined that totally. But certainly there might be positions that are more, really, it's just something that's comfortable for you. And then the ability to just kind of shift back into, that comfortable position in the middle of the night when you do wake up. Yeah.
Thank you.
No problem.
I know I used to be a tummy sleeper, but with
Oh.
chronic lung condition, you can't sleep on your tummy anymore because your lungs there's no room for your lungs to inflate. So you have to find, when you have a lung condition, you have to find a better position.
You
Oh.
bet.
Barb, I used to always sleep on my stomach too, and now I sleep on my side. And I thought, why don't I sleep on can't I sleep on my stomach anymore? I never thought about it like that.
Your lungs can't fill up with air.
Well, yeah, that makes sense.
We have the weight of our body against us, right?
Yeah. Yeah.
Well said, Barb. Yeah. Yeah. And some people might feel that on their back too, the weight of the belly pushing up on the diaphragm.
Yeah.
So maybe side is the easy answer if
I
it
did
works
see
for
something about
shoulders.
left side is what I came across. And it had to do with a whole bunch of different things, but I was like, I haven't looked into this enough to like throw that into the presentation fully.
Yeah. I sleep on my side. Yeah.
Definitely, as years go by, I have more pillows helping me out between the knees.
Definitely.
Jeannie, you've been waiting patiently. Go for it.
Thank you. I have scleroderma and with some GI issues, and I find that sleeping on my left side prevents acid reflux. It prevents the flow of the bile juice back up the esophagus, which I would possibly aspirate and cause more lung damage. So I tend to sleep on my left side, and also I sleep on a wedge pillow. So the head of the bed is higher than my waist. It's probably a 30-degree incline at the top end, maybe even, no, I don't think it's 45. It's probably about 30 degrees up. But I do slide down, by morning I'm down near the bottom of that wedge. But anyway, I do get my sleep that way.
Well, that's wonderful. Yeah. Thank you for sharing. And certainly that does kind of jive with, I see a lot of people with chronic bowel diseases and things like that. And certainly for, people with reflux, that is definitely the recommended position to be in. Yeah.
I could send a video to Tina that explains a little bit more about lying on the left side as related to scleroderma. So I'll send that to her after the session.
Sure. Or if you have a link, Jeannie, too, you could pop it in the community.
Okay.
Everyone can see it. Yeah, that'd be great. Thank you so much for all the links you've been sharing in there too. It's super great to build our resources up.
I relate to that, Jeannie.
Yeah.
Yeah.
The other thing, if the wedge pillow doesn't work, because that's what we hear from a lot of people, is you kind of slide down by the morning, is you can also put blocks under the top of your bed. So your top of the bed is just a little bit higher. Your partner may have to be on board with that, but I found most clients said that some of them that helped when they were having trouble with the wedge pillow.
Yeah, I used to use, when I used a wedge, I used to use a towel and wrap it, which gave it a little bit more grip and stopped me from sliding down. And then I saved my money and I waited for a sale, and I got my bed does it now.
Yeah, great.
It was the best thing ever. Yeah. Yeah.
Santa has a question.
Yeah,
Santa, welcome. You snuck in there.
yeah. I'm sorry. I apologize. I popped in from another webinar of patient by patient webinar in international patient research participants webinar. So I missed the part. I'm very interested in the 5 senses. Dr. Sarah, do you mind in several sentences recap me the 5 senses method?
Absolutely. So with the 5 senses, it's kind of like what it sounds like. So you're just going through each of your 5 senses, as many times as you need to. And the nice thing is that you can do it anywhere. So, I always joke with my clients, if you can do it in my office, you can pretty much do it anywhere. And so just checking in, what do I smell? What do I taste? What do I feel? What do I see? What do I hear? And, I was telling everybody, you can kind of cheat too, so I keep some essential oils to smell. And, I even keep very close by some little bars of chocolate to have something to taste. So, but yeah, it's a nice one that you can kind of use on the go, and you can use on your couch, and you can use in bed, and there's no rules with it. So it's one of my favorites.
So do you mean using our 5 senses to build up that awareness, that consciousness?
So what we're doing with the 5 senses, it's a mindfulness tool. So we're connecting our brain and our body to the present moment. And what that does is, when we're feeling anxiety, we're thinking in the future. Anxiety is very much about what could come or what might come. So we're reminding our brain and our body of what's actually going on in front of us. And, if we're having the time to do something like mindfulness, generally speaking, there's no bear that's about to chase us, or a saber-toothed tiger, so we have that ability to feel safe, and we're in a safe environment. So that can just bring down that level of, kind of activation that our body's feeling in the moment.
Mm-hmm. Yeah, or as you said, we can bring the essential oil with us. So every time I feel anxious, I can smell the essential oil, and then we condition ourselves into a calming state.
Bingo. Yeah. So you get kind of that double benefit, so on the go, you start to feel a little bit calmer, but then you start to make that association, so that as soon as I pull out the essential oils, and I smell that smell, my body starts to react and go, right, when I smell that, I feel relaxed.
Yeah. Thank you.
No problem.
They even sell little like roll-ons or little things you can carry. Yeah. Connie, you got your hand up. Well,
there. I was going to say, I've certainly done this census thing before, and one of my difficulties with it is that I have no sense of smell. And so I have been sort of doing an imaginary smell thing. And the other thing is that I live in a very quiet place. So I often don't hear anything either.
Right.
Or any of the other things, like it's sort of a big nothing. And so, I'm wondering how I can make it more connected.
Great thinking.
Present rather than imagining things.
And you know what? I do have some people sometimes imagine things. So even for taste, if people aren't hungry, I have them imagine like tasting their favorite thing to taste. If I don't have chocolate, I'm imagining chocolate. So that's actually a really great way, because our body reacts as if it's happening, and as if, we can smell that smell. So as long as you're not trying, imagining something that you wouldn't enjoy smelling, you should get the same benefit.
Oh, okay, good.
That's perfect. And then with, even a quiet room, my office is fairly quiet usually, but there is like the hum of the air, going on and off every once in a while, or little creaks and cracks, so even just focusing on those things around you, Or, you know, if you're really kind of struggling and you want something else to hear, you could put on a song, you know, that you enjoy. You know, so there's different ways to do that. And even in the quietest of rooms, you know, we can usually find something to hear.
Great, thanks.
No problem.
We can listen to the hum of our concentrators.
Yeah, I was gonna say there, if you don't mind me saying, is the TV, if you have like regular cable or whatever, there's something called, Stingray, and you just say Stingray Nature, and it'll come on, and it's lovely because you hear the birds and you hear the wind going through the trees, and it's nice, restful, like you just feel like having a relaxing and closing your eyes, and I turn it down low, and it's just there. I don't, it works for me anyway.
I love that.
Stingray Nature, love that. Bobby.
Okay, just a few things. Pursed lips, like I've always been taught, like, you know, I lived in a place over 3 stories. So I was always taught when I'm going to go up, like, do my pursed lips breathing as I was going up the stairs. And now you're saying that that's going to be something that you could use if you have an anxiety attack.
So that's actually something really important to distinguish between. So all of these things are, you know, they're used at their best before we get to the anxiety attack. So kind of when we're on our way to that anxiety attack, you know, because I kind of think of the anxiety attack as like the top of the mountain. So when we're on our way up or on our way down, that's when they're going to be really, really helpful. When we're in the middle of an anxiety attack, when we're at, you know, like 10 on 10 anxiety, you know, the best thing we can do for it is actually just wait it out a little bit. Okay, and let it come down a bit, because that teaches our body, first of all, that we don't need to do anything in particular to make this go away. You know, if I tell my body that I need to do something to make it go away, that then makes it, that, you know, kind of earmarks it as being something dangerous. So my body then wants to avoid it all the more. If we tell our body that there's nothing dangerous and we just kind of let it happen, because we're kind of, you know, stuck in that cycle once we're up there. Once we're at the 10 on 10, we're in the 10 on 10. And so we can just let it come down a little bit. Once it comes down a little bit, then we can do some of these breathing exercises to bring it a bit down a bit further. But I'm glad you brought that up, because that's such an important distinction that I want to make sure everybody gets. Yeah.
That is so interesting. I haven't heard that before. I really like the theory on that. That's great.
Good. Okay, and then the next thing is, I just tell you that, sorry, I have an app on my phone called Insight Timer.
Oh yeah.
And it's just, it does cost money. You can be a Plus membership, but for most of it, it's free. And you can go 3, 5, 10, 15, 30, 60 minutes, and it tells you about anxiety and all these other cool things. You can go into that and do that. So they have a lot of free stuff. So it's really good. And I've always found something free. I've never had a membership. Of course, if you have a membership, you can have more things, but you don't need them. They have lots of free. Insight Timer, and it's a bowl, actually.
Taught me something. So I just wrote that down because I'm now going to go download that when we talk. Yeah.
Yeah, and it's a Tibetan bowl is what it looks like.
Yeah,
yeah.
I can back you up on that one, Bobby. I like it too.
Oh yeah, no, but just because it has so many awesome free ones, like something will happen and then I'll happen to go to my Insight Timer and I'll look it up and I'll think, wow, it's right there. In 5 minutes, I can just do that real quickly for free, So anyway,
amazing.
Yeah, and there's different people that run the meditations or whatever, and you kind of find the ones that you like.
Yeah. And then the next thing is Dr. Sarah, do you take private patients on Zoom or?
So I do right now. I'm just expanding my clinic, so that's keeping me a little busier than usual.
Yeah.
But right now, I also have to, I'm looking into kind of the rules. The rules are changing, so there may be I may be able to open up my practice to BC. Right now, the current rules are that I'm able to see clients in Ontario only. But yes, I do see private clients.
Well, yeah, of course, because I've got extended medical and I don't know if they let me write you off in Ottawa when I'm in BC. Yeah, that's great. So good. Do you have
Thank you so much. And
you have a
I'll put
website?
her website, in the chat here.
Okay.
It's a great question, Bobby. And I'll do a little time check here too. So we've got 10 more minutes. I have one last question, if that's okay, because this is a question I would often get from clients. So when you bring that awareness that your anxiety is this threat that you're seeing in the future, and you work on some of these techniques to kind of calm that anxiety the best that you can, but you're still kind of plagued with it. How do you know when to go to a doctor, when to perhaps seek medications? What are the kinds of guidance tips that you can give us for that?
That's a great question. And I think it comes down to a few different things. Is it affecting your quality of life, significantly? So is the anxiety getting in the way? So, we talked about, the impact of having a chronic lung condition, and that in and of itself, can be limiting. But then also, am I feeling limited because I'm feeling anxious about doing some of these things? Then that might be a time to consider talking to somebody, and just finding ways to work with the anxiety rather than against it. And working with somebody who in particular knows about chronic lung conditions, knows about how to work with these things, because a lot of people will claim that they know, and then they don't really have quite the same understanding, and they might actually do things that could be, or suggest things that could be harmful. So just, paying attention to what is the impact on my life. Medication, that's always an option. A lot of things with anxiety can be generally managed with kind of behavioral strategies, but if it's really feeling overwhelming, then certainly medication is an option that's there. I like to say it gives you that early advantage to kind of then work with some of the anxiety. So it really helps with kind of bringing down the level of anxiety that you're feeling. You'll still feel stuff. It just brings it down to a more manageable feeling. And then with the behavioral strategy, so the stuff that a psychologist or a psychotherapist would work with, or a social worker, that they would be taking you through tools and techniques to more manage that on the go, and maybe even bring it down even further, and kind of change our approach to the anxiety, because that's a huge piece of the work. Anxiety has a whole lot of power because we give it a whole lot of power. And so if we take some of that power away, then it becomes a lot more manageable, and, I can kind of live alongside my anxiety, knowing that it's going to pop up every once in a while, with a little question or concern. And then I can, kind of redirect it a bit.
Amazing. Thank you so much. Wonderful. Sarah, thank you so much for being with us today and sharing these tools. I'm going to hand it off to Tina to close off our session today.
Sure. I've been listening and taking notes, and now I'd like to run a pop quiz. So we're going to do a true or false. Okay, anyone who's game, we're going to do a true or false. Just a few fun questions. Come on. All right, true or false? Anxiety can give me breathlessness. You are correct. Yes, it can. Yes, it can. All right. True or false? Anxiety and depression can cause a chronic lung condition. No, they cannot cause a chronic lung condition, but if you have a chronic lung condition, it can lead to anxiety and depression. Yeah. At the peak of an anxiety attack, waiting it out, waiting for it to calm down a bit can be a good thing to do. Yeah, it can. We just learned that. All right. So what can help with these anxiety attacks? What can help? Progressive muscle relaxation? Yeah. Overeating junk food. Although we did talk about chocolate a lot. Just want to reinforce that. Focusing on the 5 senses. Yeah. And getting enough exercise. Yeah, you guys all passed. Amazing. All right.
Awesome. I'm going to just share my screen one last time here. So thank you all. Oh, that might be the wrong screen. Let's see. No, try that again. Thank you so much, everyone, for joining us. So we will bring you these sessions once a month. The second Wednesday of every month will be the Better Breathers Club of BC at 2 p.m. Pacific time. So we hope you'll join us for the next one. We'll be posting the topics in the Poplar community. So you can look out for those. Do spread the word, share it, friends, family. We really appreciate it. Let's try this one more time here. There we go. There's our little icebreaker ice. So thank you once again. Thank you, Tina, for the trivia. Just a reminder, so Dr. Sarah will keep us posted in terms of these cross-provincial ability to provide care. She'll let us know as soon as she's able to take on clients from BC. In the meantime, reach out to us in the Poplar community if you're looking for experts to work with here in BC. We do have Laura, who's a respiratory therapist, certified respiratory educator, and health coach, who can work with a lot of these mental health strategies in our Poplar clinic. As well, we'll continue to post resources and support links in our Poplar community, which is free. Our website is there, as well as the BC Lung, and I've posted Sarah's 4wingpsychology.ca in the chat box. So thank you so much. Get out there, live your best long life, as we say here at Poplar, and it's been wonderful spending this hour with you all.
Yeah, thank you all for coming, and thank you to BC Lung for providing us with this opportunity, and thank you, Sarah. That was amazing.
Thank you, guys.
Thank you, Dr. Sarah.
Thank
It was
you.
nice.
Have a wonderful afternoon or
girls.
evening, everyone.
Hope everyone.
Come join us singing now for the next hour.
That's right. So we will, Jeannie's been amazing in our community with these resources. So the Better Breathing Choir, which is out in Newfoundland, run by a music instructor, Jane, as well as a physiotherapist. They meet once a month. Is that right, Jeannie?
No, it's every week. Every Wednesday.
Oh, every week. Every Wednesday at 3 p.m. our time. What time is it there now, Jeannie? 7?
It's almost 6 o'clock Eastern time, and it will be
6:00 Eastern time.
Newfoundland time.
There you go.
7:30.
Newfoundland time.
Yeah.
Newfoundland time. And so everyone joins in to sing, which can actually help with your breathing mechanics. You can mute yourself. You could be on Zoom. There's a little bit of exercise warm up to get started. So we will actually be putting a page with all of that information in the Poplar community, and Jeannie's posted about it And I've put Jane's email there, and you can get in touch to be on her email list for the Zoom link.
Thank you.
Yeah.
All right. Thanks, Jeannie.
Yeah, thanks, Gina.
All right, that's where I'm going now.
Okay.
Have fun.
Bye.
Happy
Bye,
Saints.
guys.
Bye.
We'll be there next time, Jeannie. We can't make it today. Tell her
Okay.
we're coming. Okay.
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 Thank you. Thanks, Sarah.
Oh, you're welcome. Have a great day.